Do you know what hepatitis is and how it affects your body? Hepatitis, in essence, is an inflammation of the liver, often sparked by viruses. However, it's not just viruses that play the villain here. Toxins, certain medications and some medical conditions can also instigate this inflammation. To guide us through this complex terrain of liver health, we're joined by Dr. Mehul Agravat, a renowned hepatobiliary and pancreas surgeon. With his extensive experience in laparoscopic gastrosurgery and liver transplantation, he's well equipped to navigate us through the intricacies of hepatitis. Today we'll delve into the different types of viral hepatitis, A, B, C, D and E, each with its own mode of transmission, effects and preventive measures. So brace yourselves for an enlightening journey into the world of hepatitis. Join us as we explore the different types of viral hepatitis and their impact on the body. First on our list is hepatitis A, a virus primarily spread through contaminated food or water. This fascinating yet deceptively dangerous virus is known to cause acute or short-term inflammation of the liver. Imagine this: you're enjoying a lovely meal at your favorite eatery. Unbeknownst to you, the food or water you're consuming has been contaminated with the hepatitis A virus. It enters your body and heads straight to your liver, where it begins its destructive work. Frightening, isn't it? Now you might be wondering, how can I tell if I've been infected? Well, symptoms may include fatigue, nausea, abdominal pain, loss of appetite, and jaundice, which is the yellowing of the skin and eyes. However, these symptoms don't show up immediately. They usually appear 2 to 6 weeks after exposure, which is why hepatitis A can often catch people off guard. But it's not all doom and gloom. The good news is that our bodies are capable of completely clearing the virus, leading to lifelong immunity. That means once you've had hepatitis A, you can't get it again. Better still, hepatitis A doesn't cause chronic liver disease, unlike some of its counterparts. Now let's talk prevention. The most effective way to prevent hepatitis A is through vaccination. The hepatitis A vaccine is safe and nearly 100% effective. It's typically given in 2 doses, 6 months apart. Apart from vaccination, practicing good hygiene is also crucial in preventing hepatitis A. Remember to wash your hands thoroughly, especially after using the bathroom and before preparing or eating food. If you're traveling to areas with poor sanitation, be cautious about what you eat and drink. With the right precautions, hepatitis A is entirely preventable. By understanding how the virus works and how it affects our bodies, we can take proactive steps to protect ourselves and those around us. Knowledge, as they say, is the first step towards prevention. Next up are hepatitis B and C, the most common causes of liver cirrhosis and cancer. Hepatitis B is a major global health problem. It's transmitted through contact with the blood or other body fluids of an infected person. This can happen through sexual contact, sharing needles, syringes, or from mother to baby at birth. Hepatitis B can cause a range of health issues, from mild illness to severe liver disease, including cirrhosis and liver cancer. Prevention is the key to managing hepatitis B. Vaccination is the most effective measure to prevent this disease. Other preventive steps include using condoms during sex, not sharing needles, and getting tested regularly if you're at risk. Now, let's talk about hepatitis C, another major cause of liver disease. Unlike hepatitis B, there's no vaccine for hepatitis C. This virus is most commonly transmitted through direct blood-to-blood contact, often through injection drug use. Hepatitis C often shows no symptoms, making it a silent killer. When symptoms do appear, they can include fatigue, loss of appetite, and yellowing of the skin and eyes. Over time, it can lead to serious liver damage, cirrhosis, and even liver cancer. Preventing hepatitis C involves avoiding behaviors that can spread the disease, especially injecting drugs. If you're at risk, regular testing is crucial. If you're diagnosed with hepatitis C, treatments are available that can cure most people. When it comes to hepatitis B and C, these viruses don't discriminate. They can infect anyone, regardless of age, race, or socioeconomic status. But with knowledge and awareness, we can protect ourselves and our communities. Awareness and prevention are our best weapons against hepatitis B and C. Lastly, we'll discuss hepatitis D and E, each unique in their own ways. Hepatitis D, also known as delta hepatitis, is an intriguing one. It's a bit of a rogue in the world of viruses because it can't survive on its own. You see, hepatitis D requires the presence of hepatitis B to replicate. It's a bit like a parasite, attaching itself to hepatitis B and using its resources. This co-infection can lead to a more severe form of liver disease and a higher risk of complications, including liver cirrhosis and cancer. It's transmitted through contact with infected blood, unprotected sex, and from an infected mother to her newborn. Now, onto hepatitis E, which is similar to hepatitis A in terms of transmission. It's typically spread through contaminated food or water, particularly in areas with poor sanitation. Unlike hepatitis A, however, there's no vaccine for hepatitis E. It's most dangerous for pregnant women, particularly in their third trimester, where it can lead to acute liver failure, fetal loss, and even maternal death. In developed countries, cases of hepatitis E are often linked to consumption of undercooked pork or game meat. It's a stark reminder of the importance of food safety and hygiene. A peculiar aspect of hepatitis E is that it can cause chronic infections in people with weakened immune systems, such as those with organ transplants. This can lead to significant liver damage over time. So, although hepatitis D and E are less common than their counterparts, they are not to be overlooked. Both pose unique challenges and risks, and understanding them is crucial in our fight against viral hepatitis. While less common, hepatitis D and E still pose significant health risks. Remember, knowledge is our greatest weapon against these diseases. Let's continue to learn, stay vigilant, and promote health and wellness in our communities. Understanding hepatitis is crucial for maintaining liver health and preventing the spread of these viruses. In the past few minutes, we've delved into the world of hepatitis, exploring the different types of viral hepatitis, A, B, C, D, and E, and their impact on the body. Let's recap. Hepatitis A and E are typically spread through contaminated food or water, leading to acute inflammation of the liver. Proper sanitation and hygiene are essential to prevent these types. Hepatitis B and C, on the other hand, are usually transmitted through contact with infectious body fluids or blood-to-blood contact. These types are notorious for their potential to cause liver cirrhosis and cancer if left untreated. Lastly, hepatitis D, a unique virus only affecting those already infected with hepatitis B, heightens the disease severity. Now let's talk about prevention. For hepatitis A and E, it's all about maintaining good hygiene and sanitation practices. Ensure that the food and water you consume are clean and safe. For hepatitis B and C, the use of sterile needles, safe sex practices, and avoiding direct contact with blood and body fluids are key preventive measures. Vaccinations are available for hepatitis A, B, and E, and they provide a strong line of defense against these viruses. Regular checkups are also vital. They allow for early detection and timely treatment, significantly reducing the risk of complications. Remember, hepatitis B and C can linger silently in your body for years, causing gradual damage to your liver. Early detection can save lives. Knowledge is power, and being informed about these viruses and their prevention can go a long way in maintaining your liver health and overall well-being. So, arm yourself with information, take the necessary precautions, and stay vigilant. Thank you for joining us in this informative session. Stay healthy and stay informed. Stay